This is RTV6 News at 5:30, working for you.
And now at 5:30, a new emergency room is now open to treat patients. How this will make patient care even better. Chris.
Checking in on today's lineup, many people are working from home longer than they expected, and we're taking a look at what may be making feelings of burnout even worse and how to bring it up with your manager. And more of us are dealing with what doctors are calling COVID-somnia, why fighting this may be even more essential than you realize right now. And we're going to take a look at how we'll vote during a pandemic. It's not the only worry leading into the November election, though, how volunteer cybersecurity experts are working to protect states from ransomware attacks.
Location, location, location. This is what I'm talking about. Looking north from downtown Indy, you see the breaks in the cloud cover. Heavy rain has moved off to the east. Bloomington, boy, you had a downpour. Anywhere from IU's campus, about an inch of rain to the southeast side of Bloomington, an inch to almost an inch and a half in some spots. This is what it looks like as you're looking west across White River, west of Indy, some light showers, but the heaviest rain has moved on. There's the heavy rain. It's cleared Bloomington and Monroe County, northwest portion of Jackson on up toward Nashville. Heavy rainfall will slide to the east into Bartholomew County, and again, a quick half inch or more possible there. Off to Hancock County, Greenfield, over to Muncie. This is pushing east. At least with the movement, you won't get too much rain in any one spot, but as we showed you in Bloomington, you could see an inch. North and west of Indy, not much happening. I think most of the action is going to continue to be south and east of the metro area as we go through the evening. 8 o'clock, ongoing showers, thunder showers pushing to the east. By the time we get to 11 for the news, rain will be departing to the east. Temperatures, they'll be cool. Temperatures in the 80s, as you can see, would be average. We'll struggle across central Indiana until about Friday to get into the 80s.
Thanks, Kevin. And now at 5:30, a new emergency room opened today in Johnson County. This comes after a multi-million-dollar investment to improve access to health care in the area. RTV6's Rafael Sanchez gives us a tour.
This is the new emergency room at Johnson Memorial Hospital in Franklin. As it opens for its first patients, the hospital will have more rooms and new technology to handle people's critical medical needs.
We also have some advancements in the ER. We have lifts in our trauma rooms to help move patients. We have more decontamination areas in case there were a chemical spill.
The new ER was the COVID-19 unit, now moved to the second floor. Since the pandemic began, Johnson Memorial treated as many as 7 COVID-19 patients at one time. The newly relocated unit has 6 isolation rooms. Lissy Miller is among the nurses on duty.
It is the real deal. Working the front lines, we have seen so many cases and how bad things can get. Luckily, our numbers are down right now, but definitely wear the mask, definitely social distance.
It has been a tough road for small hospitals weathering the COVID-19 tsunami. The virus has battered and bruised many budgets, and Johnson Memorial Hospital is among those that remain open and in stable condition.
The leadership here at this organization has always thought about staying fiscally sound, and sometimes that means not investing in all service lines. You look here, we don't have a cath lab, we don't have radiation oncology. We haven't been able to bring everything to this campus that maybe we could. We have to be fiscally sound.
Rafael Sanchez, RTV6.
And the new ER will now have 26 beds. The old ER had 15. And the old ER facility could be used for other purposes. The hospital says that is under review. Chris.
We're in a new phase of this pandemic, according to the White House Coronavirus Task Force. Dr. Deborah Birx says most states are seeing a rise in infections every week, and the number of cases in the U.S. accounts for more than a quarter of cases worldwide.
We're seeing rises in a lot of states, and now we're talking about reopening schools and colleges in the midst of that, which I think is just going to compound our problem significantly.
The CDC predicts nearly 20,000 more COVID-related deaths by August 22nd. That's close to 1,000 deaths per day between now and then. A growing coronavirus concern, the disproportionate impact to people living with diabetes. The American Diabetes Association tells us that 40% of COVID-19 deaths have been from those with the disease. 90% of the hospitalizations have been people with diabetes or other underlying health conditions.
Diabetes was a health crisis and epidemic in this country before the pandemic. what the pandemic has done really is shine a very bright light on an old problem.
CEO Tracy Brown has lived with diabetes for 16 years. She's worried about additional financial struggles brought on by the pandemic. Now, even before COVID, 1 in 4 people were rationing their insulin to get by. Brown says the current unemployment rate is higher among people with diabetes, so the burden has only worsened for those that have lost health coverage because of job loss. The disease also disproportionately impacts people of color living in low-income areas. Brown says even now in 2020, every 5 minutes, someone in the U.S. loses a limb because of complications from diabetes.
There are so many comorbidities that go along with this, which is another reason why I talk about the fact that if we want to address the well-being of Americans and improve the well-being of Americans, you can't have that conversation without having a conversation about improving diabetes.
Brown wants to make sure that people with diabetes don't feel like they're alone right now. Now, there is a page of resources available on their website, diabetes.org. You can also call 1-800-DIABETES if you're struggling. All right, we have more to get to in our lineup today. There are new concerns about burnout as people just continue to work from home. We're looking at the best ways to talk about this issue with your manager.
Next time you're in the soft drink aisle at the grocery store, you may notice something different. It's getting harder to find some less popular brands. Consumer reporter John Matarese shows why the latest shortage now involves Coca-Cola products, so you don't waste your money.
Coca-Cola is the #1 selling soft drink in America, but have you noticed some versions of Coke these days are almost impossible to find? It may be the real thing, but some versions of Coke are not very real this pandemic summer. Twitter is filled with complaints from people who can't find their favorite Coke product, including caffeine-free Coke, cherry Coke, and Fresca. Coca-Cola CEO James Quincy told investors they're focusing on their key brands right now, like Coke and Diet Coke, to keep store shelves stocked. They don't want Coke ending up like Lysol wipes, impossible to find. He also said the company may soon discontinue some slow-selling brands, but won't say which ones. But from the dozen that stink file, the bigger threat to Coke products, the aluminum can shortage. It's starting to impact all soft drink companies and breweries.
About 95% of our production now is all canned product. And if we can't get the cans, then we can't put anything out.
CNN blames soaring demand for canned beverages, from White Claw to craft beers. They're just people drinking more at home and not going to bars. So beer and soft drink makers are filling cans and not kegs right now. And those cans are starting to run low. So if you find a less popular brand on a store shelf, you might want to grab a few so you don't waste your money. I'm John Matarese for WRTV 6.
For those of you who have a job that you can do from home, plans to go back to the office full-time continue to be pushed back. Now, if you weren't feeling burnout before, experts with staffing firm Robert Half say you could be feeling it set in now.
If you don't raise your hand and have a really open and honest dialogue, you could continue to feel that way, and that burnout can manifest itself in you missing deadlines and you skipping work, needing to take vacation time, and it can be a weight that bears on you.
Now, he says your boss should be receptive. Many of them are feeling the same way, and that burnout can feel heavier because many people are afraid to take vacation. There's a new survey from LinkedIn that finds nearly 70% of professionals don't plan to take time off through the end of the year or aren't sure if they will. More than half say that they're afraid to travel because of the risks associated with COVID-19. 22% want to save their vacation time in case they or a family member gets sick. And even for people planning to take vacation, a quarter say they feel more pressure at work to be always on because of the current state of the economy. Now, if you're looking for a job right now, you can expect to see more openings that let you work from anywhere.
Most employers that we're chatting with right now are very upfront of saying, yes, we're okay with remote right now, but ultimately we will want that person to be working in our facility or in one of our facilities. And so you have to ask the question to be sure if you're interviewing with an employer of what does it look like in 12, 24 months, who knows how long.
Experts at Robert Half say that they expect to see more work from home jobs long term, even after the pandemic. Let's get back to our lineup. More of us are dealing with what doctors are calling COVID-somnia. Why fighting this may be even more essential than you realize right now. The problem is frankly right out of a scary movie. Aggressive bees that swarm anyone who crosses their path. In one national park, the bees are doing that as they struggle to find water. And Kai Beach shows us what scientists think is to blame and why they worry it may happen elsewhere.
They will jump on you and they'll sting you, and they can be pretty nasty.
At Joshua Tree National Park, there's a big buzz.
And the bees were actually quite aggressive, to the point where it scared my kids, like to go to the restroom by themselves and stuff.
That's right, swarms of honeybees. So aggressive that several of this park's campgrounds were recently closed for people's safety.
When we close the campgrounds, it's actually a way for us to limit the interactions between the bees and our visitors.
Park Ranger Ian Chadwick says the bees are so desperate for water and shade in this California high desert that thousands of them will seek moisture anywhere.
Our bathrooms that have a lot of good shade,
including some places that aren't so sanitary.
Water isn't plentiful in the desert, and our toilets here do not actually have any running water.
After studying these species of bees for decades, scientists now say this problem is linked to worsening weather.
So the reason that it's a problem now when it wasn't a problem 10 or 15 years ago is because of climate change and the increased aridity.
Dr. Cameron Barros is a research ecologist with the University of California, Riverside. He says the temperature has been rising in deserts at alarming rates. And in the Mojave Desert, where July averages a high of 100 degrees and less than a quarter inch of rain, this problem could sting for years to come.
There's just more bees coming in all the time. And so it's an ongoing maintenance issue. It's not just a one-time and you're done.
Despite the increase in activity,
the bees have been out in the campgrounds.
Ranger Chadwick says the number of reported bee stings is normal for this time of year.
But the bees are really looking for moisture.
But with extreme high heat making plants and streams unable to hold moisture like they used to,
so in here, this is where you're gonna be putting all of your, waste.
Chadwick says while a bee sting may be painful,
bees are going to be attracted to anything we leave out.
Losing the bees would hurt the environment even more. I'm Kai Beach reporting.
Kai, thank you. And the U.S. has finally caught its first murder hornet. Remember all the talk about that? Well, they are formally known as Asian giant hornets. One was caught in Washington state in July. The hornets are more than 2 inches long, and they have the ability to attack and kill honeybees, maybe even people. Washington's Agriculture Department is now trying to find and destroy the hornet's nest by mid-September. They warn if it's not destroyed, these hornets could spread.
Well, let's take you to the calm side of the state. This is western Indiana out in Putnam County on campus at DePauw. And you can see pretty much stratus clouds with a little sunshine breaking through. You had the downpours just like the rest of us. And I mentioned calm side of the state. Western Indiana, not a whole lot happening. And I think most of the rain is over there. Most of the action is going to be to the east, to the southeast of, say, Muncie, down to Shelbyville, and then just west of Seymour toward Brownstown. This will continue to march to the east. We'll give a closer view. You're getting some good rumbles of thunder, a nice downpour in Delaware County right at Ball State and Muncie. That follows I-69 to the southwest toward Anderson and Pendleton. Rain picks up in intensity east of Greenfield and into southwest portions of Henry County. We've not had any severe weather, but we have had some localized flooding as a result of the heavy rainfall. Southwest of Columbus all the way into Jackson County and then southeast of Bedford. This will continue to move to the east and cross I-65 from Columbus down to Seymour. Storm Shield app, you won't need it really the rest of this week, but it does have more than radar. You can get hourly forecasts, help you plan your day as well. It is free, the Storm Shield app. Temperature in Zionsville 71, 67 rain-cooled degrees down in Edinburgh, in the 60s in Greenfield as well. We've pushed the warmer air out of the state for a while. I don't think we'll be back in the 80s for temperatures until we get to Friday. The strip of green follows the area of rain that's marched through central Indiana. That will continue its move to the east and then out of the state overnight. It's possible we have a couple sprinkles in the morning, but I think that seems a little more unlikely. The temperature will be in the upper 50s to lower 60s. That's the way we'll start the morning hours tomorrow. And as you look at afternoon high temperatures, they remain below average. By the time we get to noon, 67, more clouds in the morning, a little more sunshine in the afternoon. Temperatures will work their way into the low to mid 70s The north wind lowers the humidity and creates a situation where we'll dry things out and get more and more in the way of sunshine and set up a couple of cool mornings as we go to Wednesday and Thursday. 56 the starting temperature Wednesday. We'll hit 76 for your afternoon high midweek.
Health officials are hoping to decide by late next month who will be the first people to get the coronavirus vaccine. Now, usually people with top priority for vaccines are the healthcare workers and those who are most vulnerable to an infection. But the National Institutes of Health say that leaders need to think about geography first. Schools are open or reopening in a handful of states this week. Many schools are taking a hybrid approach, switching between in-person and online learning. Families have the choice to keep kids at home if they live in high-risk households.
Schools end up being community resources. They are a place where millions of kids get meals per day. They're a place where kids get a lot of school-based health services. They are a place of safety and supervision during the school day, particularly if parents are essential workers.
Public health experts are equally invested in getting children back to school safely. Johns Hopkins University launched a reopening tracker to follow which states are taking into consideration not only safety, but equity issues. Now, there's significant concern about disadvantaged students and the learning gap expanding beyond what was already there. Consulting firm McKinsey & Company found in the best case scenario, students will only lose 3 to 4 months of education, and that's if they go back in person by January. But the learning loss could be as high as 14 months for those who only have access to low-quality remote learning or aren't engaged in remote learning for one reason or another.
What is complicated, and I think we're trying to get better at, is even if you give somebody technology, if they don't know how to use it, you're still going to have an access issue.
The virtual-only return also puts increasing demand on meeting other needs for disadvantaged school kids long-term, like healthcare and food. Now, we've told you about the effects the pandemic has been having on how Americans sleep, including strange dreams. But some are experiencing another side effect that is leaving them exhausted. Usher Qureshi spoke to doctors about what you can do to fight pandemic-induced insomnia.
No morning commute, nowhere to drop the kids off. The stress of the pandemic, coupled with a lack of scheduling anchors, is leading to sleepless nights.
They could have difficulty falling asleep, or what I'm seeing most commonly is difficulty staying asleep.
Dr. Kathy Goldstein is an associate professor of neurology at the University of Michigan, specializing in sleep disruption. She says being stuck at home with unusual schedules shifts our internal body clocks, known as circadian rhythms, in unhealthy ways.
Now we don't have to get up and go anywhere. So I see people push their clocks later, and they're falling asleep later at night, and then they're sleeping in. And so the subsequent day, they can't fall asleep.
Pandemic-induced insomnia, or COVID-somnia, she says, is also being compounded by overconsumption of media on laptops, cell phones, and tablets.
They also allow us to bring little miniature suns into the sleep period.
A recent survey found that 98% of Americans developed sleep problems post-lockdown, and 68% feel stress or find it hard to sleep even after the lockdown. Between mid-February and mid-March, as the outbreak began ramping up, prescriptions for sleep medications jumped nearly 15% compared to the same time last year.
We have seen an increase in prescriptions for insomnia medications, but we do recommend patients try lifestyle changes or OTC, which are over-the-counter supplements.
Things you can do to combat COVID-somnia: exercise early in the day, set an alarm to wake up at the same time each day 7 days a week, and disable the snooze button. Start winding down several hours before your fixed bedtime, and put phones and tablets away at least 2 hours before you hit the sack. One other tip Dr. Goldstein recommends is using amber blue blocking lenses to help with screens and energy-efficient bulbs that emit blue spectrum light.
So by putting on those glasses 4 hours before bedtime, you're getting rid of that circadian disrupting light. So that's a huge help.
Experts say sleep is even more essential while trying to confront the COVID-19 pandemic.
The lack of sleep, it directly affects not only your physical health, but your mental health.
I'm Usher Qureshi reporting.
Usher, thank you. And finally, in our lineup, how we'll vote during a pandemic isn't the only worry leading into the November election. How volunteer cybersecurity experts are working to protect states from possible ransomware attacks. COVID-19 isn't the only concern with the upcoming election. The FBI and Department of Homeland Security have issued advisories to local governments about possible ransomware attacks, something like malicious software blocking officials from access to voting systems. Experts think that it is actually a more likely scenario than altering actual votes.
The only way to ensure confidence is to demonstrate that you've done everything you possibly can to facilitate that safe and secure election.
Maya Werman is head of the Election Cyber Surge Initiative. It's led by the University of Chicago, and it's pairing local election officials with volunteer cybersecurity experts. Now, they can address specific areas of cybersecurity concern.
And the biggie, I think, is human error, user error, whether that is accidentally sending sensitive information to the wrong person, not having a strong password management system, sharing passwords.
The pandemic adding further complications with just more than 90 days to go to Election Day. Werman says they felt the urgency to be proactive in helping election officials.
Now we've got so many people working from home on their own devices. An organization has no insight into what the security around your home Wi-Fi or your home devices is.
Now, this free resource, it's something that could be very important for elections because some states really rely on staff or federal assistance for cybersecurity. Others will pay private companies. This pandemic also could mean a reduction in volunteers, a new need for PPE, and an influx of absentee ballots. Now, petitions are popping up across the country demanding colleges to lower their tuition. Students say since many classes will now be online, they shouldn't pay the same price. Tomorrow, see whether colleges are listening and what students are threatening if they don't.
I bet you probably got caught in the downpour today. Either you're waiting in your car to make a dash for it once the rain stops, but it's all going to come to an end fairly quickly here as we go through the evening hours. It'll last a little longer in the eastern portion of the state. There is unveiled your 7-day forecast. We'll go into more intricate detail there, and we'll also go on a radar tour here.